Hi, this is Dr. Rehan Amar. I'm professor of cardiology, consultant interventional cardiologist, and today I'll be talking about heart failure. There are some misconceptions about heart failure that needs to be told to the general public because among laymen, the term heart failure brings about goosebumps and patients and their relatives think that the patient is about to die. So let me clarify with one simple statement that heart failure does not mean death. Heart failure simply means weakness of the heart muscle, that the pumping function of the heart gets compromised, and that is known as heart failure. In the past, there were broadly two categories of heart failure: the systolic heart failure and diastolic heart failure. And there are some other causes of heart failure like cardiomyopathies, and then, of course, different congenital conditions as well as collagen vascular disorders. But nowadays, we ascribe heart failure to be composed of different varieties, not only the pump failure or the systolic function, but also pump stiffness, in which there's long-lasting high blood pressure patients who develop stiffness of their cardiac muscles and the heart becomes stiff, unable to pump the blood forward. And that's the reason why there is a dry heart failure. There is no systemic congestion in these kind of patients, usually. So heart failure, basically the commonest causes are heart attacks. Heart attacks leads to weakness of the pump, and then the patient's ejection fraction goes down, and there is systemic and pulmonary venous congestion, thereby leading to symptoms of dyspnea or shortness of breath on exertion. And in the advanced stages, the shortness of breath is manifested even at rest or on the lying position. In diastolic heart failure, which is because of the stiffness of cardiac muscles, the patients also have dyspnea, but that is because of the raised left ventricular and diastolic pressures. I know these terminologies seem to be quite technical, but for layman, the definition of heart failure is that there are constellation or the products of symptoms, signs, and certain laboratory parameters that makes the diagnosis of heart failure confirmed. The symptoms of heart failure are shortness of breath, generalized weakness, asthenia, um, cold sweats. The patients feel tired most of the time. They become short of breath on exertion. In advanced stages, they become short of breath even at rest or on lying down position. And then there are symptoms like palpitations, weakness, tiredness, sweating, etc., etc., lack of appetite, lack of sleep. The signs are, of course, if the patient has systolic heart failure, the forward output is decreased because of weak pump of the heart, and the blood pressure starts going down. And then there are arrhythmias, and then there are different findings also on auscultation. An echocardiogram will reveal that the patient's ejection fraction has gone down, and with or without left ventricular cavity dilatation. In diastolic heart failure, the cavity thickness increases, uh, uh, resulting in increased left ventricular pressures, and that's the reason why there is increased backflow towards the lungs, resulting in pulmonary venous congestion. So, whatever the etiology is, the symptoms are almost the same. The patients have dyspnea or shortness of breath, palpitations, weakness, tiredness, and that does not necessarily mean mortality. Yes, of course, heart failure is the final end product of preceding diseases like diabetes, hypertension, ischemic heart disease. But we have now ample evidence that there are different drugs, devices that can prolong the lives of the patients as well as improve the quality of their lives. And we have so many medications available. We have miraculously developed medications that can improve the cardiac pump function, the cardiac pressure systems, the forward flows. There are drugs which can prevent venous congestions as well as the pulmonary venous congestions. So it's all not all red. So we have green news as well, and they are that we have diuretics, ACE inhibitors, ARBs, ARNIs, SGLT2 inhibitors, and if the patient fails these therapies, we do have devices like LVAD, like CRTs, ICDs. So we have so many devices and treatment available so that we can prolong the lives of our patients. In the past, the heart failure patient used to die within a year. but now heart failure patients can live substantial amount of time. And in the hardest core scenario, in the latest problems of left ventricular pump function, which gets disturbed, we also have limited availability of heart transplant, which is happening in some centers, with advanced centers of the world. So my humble advice to my patients would be that if any of their siblings or any of their relatives are suffering from heart failure, first of all, choose your physicians wisely. You should always go to a cardiologist who has expertise in heart failure. It does not necessarily mean that you go to an interventional cardiologist, because most of the heart failure specialists are not interventional cardiologists, because they deal with medications and they deal with devices. So try to opt and choose a doctor who knows how heart failure is managed properly according to the guideline directed medical therapy, and then stick to that doctor, because that doctor will take your detailed history and then will follow you up over a period of time. So you have to stay in touch with the doctor. You have to report every single symptom, every unusual symptom that is happening to you. And also there are certain non-pharmacological aspects that you need to take care of. If any of you is suffering from heart failure, you or your relatives or siblings, the first and foremost is fluid restriction. We don't have to overtake or over enthusiastic fluid intake that can be very detrimental and harmful for your body. Excessive salt consumption, because whenever you take salt, that will retain water and there will be more fluid in your system, causing congestion. So fluid restriction. In temperate climates, you can take up to 4 or 5 glasses of liquids, including water, Pepsi, Coke, whatever this liquid is. So in total, there should be not more than 4 to 5 glasses. Salt, 1.5 gram per day, or you have to restrict less than 1 gram per day in patient with heart failure. And then of course annual vaccinations like influenza and COVID, and 5-yearly vaccinations for pneumococcus. These are mandatory in patients with heart failure, because these patients, they can develop respiratory tract infection quite frequently. And then of course they have to opt for quality rehab, which is cardiac rehab. They have to be given exercise prescriptions by their doctors, and then they have to be optimized on medical therapy with periodic follow-ups. So this is the brief guidelines for managing your patient with heart failure. Heart failure does not mean death. Yes, it does cause a decrease in the years of living, but with the advent of so many miraculous drugs, the life expectancy of patients with heart failure can be significantly improved. Thank you very much.